Hi everyone, and welcome to Lesson 3 and 4 lecture. In Lesson 3, we're going to discuss the integumentary system, colors, and plural endings. We did get a little bit of an introduction to plural endings when we talked about the words staphylococcus being singular and staphylococci being plural. So we are going to learn in these two lessons how to build, translate, pronounce, and spell medical terms built from word parts as well as those not built from word parts. And we'll also look at some more abbreviations. So let's dive in. So as I mentioned in a previous lecture when we were talking about body systems, one of the body systems is the integumentary system, and that is basically composed of the skin. Now there's a lot of supporting structures as well. So the skin has two parts. It has the epidermis and the dermis, and you can see that here in this image. You can also see the hair follicle and the hair that breaks through the epidermis. And there's also sweat glands and sebaceous glands and some various vasculature and nerves or sensory receptors that are located in the dermis. So let's talk about the functions of the integumentary system. If you remember from before when I mentioned the integumentary system, I said it's our body's first line of defense. All right, so the body protects against harmful environmental elements. It protects us from our outside world, and it also protects us against fluid loss, but it also produces vitamin D, and that is kind of where the sun comes in, because as we are exposed to the sun, it stimulates our skin to produce this vitamin D. What else does it do? Well, it helps us to regulate body temperature. If you've ever noticed when you're outside and it's really hot, or if you're exercising or something like that, you may start to sweat or perspire. And that is because the skin works to regulate our body's temperature when it's too hot. But it also helps to regulate the body's temperature when we're too cold. So if you've ever been in an environment where you're cold and you start to shiver, that is your body trying to warm itself up. What else does it do? Well, it excretes waste through a bazillion pores or little openings that are in the skin. And it also provides sensory information. Again, like I said before, it helps us to sense our outside environment, our surrounding environment. All right, so like I promised, we're going to build, translate, pronounce, and spell some medical terms that are built from word parts. So what are some of those? Well, the first one is acro. And acro refers to extremities. And I think of the word acrobat. And I see in my mind that they're swinging from trapezes and balancing themselves on high wires. And that helps to remember that acro means extremity. What about cutaneo? Cutaneo is one of the word parts that means skin. Dermo and dermato also refer to the skin. And then we have myco. Myco refers to fungus, okay, like mycosis is the condition of having a fungus. Onchio refers to the nail, which is a very strange word, I think. Cyano, remember we said we were going to talk about some colors. All right, so cyano means blue. If a patient is cyanotic, that means that they have a bluish tinge to their skin, and that could clue us into something that's going on with the patient. Now, in the case of cyanosis, that means that could mean that they are not getting enough oxygen to their tissues. Now, erythro is the word part that means red. Think of erythrocyte. Erythrocyte is the word that we use for red blood cell. Now, the word part for white is leuco. Again, the word leukocyte refers to a white blood cell. Melano is the term or the part that means black. Again, I can use melanocyte as an example. Melanocytes are the cells that give the pigment to our skin. So some individuals have a lot more melanocytes than other individuals, or if you are prone to spend some time out in the sun or in the tanning bed, that increases that melanin and those melanocytes in the skin. And then the last one here for combining forms that represent different colors is xantho. And xantho means a yellow. Xanthosis, the condition of yellow. All right, and then we have some suffixes, and this is awesome, isn't it? They really have no meaning. They're really just stuck on the end to help us with pronunciation. And then we have itis. Itis means inflammation. Remember, arthritis, inflammation of the joint. Arthro meaning joint, itis meaning inflammation. Osis refers to an abnormal condition, right? Cyanosis, an abnormal condition of being blue. And then ous meaning pertaining to. Another suffix that we need to familiarize ourselves with is tomi. And this suffix means to cut into, or in size. All right? Now let's look at some prefixes. First prefix we're going to look at is epi. Remember epigastric? Right? Pertaining to, upon, or over the stomach. Hypo, like hypodermis, below the dermis, okay? Hypothermia, a temperature that is below the normal temperature. The prefix for within is intra, intradermal. Intradermal means within the dermal layer. Per is the prefix for through, like percutaneous, right? Pertaining to going through the skin. And then sub, below or under, subcutaneous, okay? Hypodermis, subcutaneous. And then the last one here for prefixes is trans, and trans means through. Remember the transverse plane. The transverse plane goes across or through the body. Remember dividing it into superior and inferior portions. All right, so some examples I gave. Cutaneous, right, pertaining to the skin. Dermal, pertaining to the skin. Dermatitis, inflammation of the skin. Dermatologist, one who studies or specializes in the skin. Dermatology, right, that is the study of the skin. Dermatopathologist, what does this person do? If you said that they specialize in diseases of the skin or skin diseases, you would be absolutely correct. And then we have dermatopathy, which is a condition or a disease of the skin. And then we have epidermal, right, which is above the skin. Some other words that we can build and some examples that I already gave. Hypodermic, pertaining to below the skin, right? What about intradermal? Take a second. What does that mean? If you said pertaining to within the skin, you would be correct. Onychomycosis. Remember we said onycho means nail and myco means fungus and osis is a condition of or abnormal condition of. So here we have abnormal condition of fungus in the nail. Onychosis is simply an abnormal condition of the nail. Maybe it's fungus, maybe it's something else. Onychotomy. Remember we said tomy is to cut into. Cut into me. Okay, maybe that's a way that you can remember that. So this would be cutting into the nail. Percutaneous, pertaining to through the skin. I think I gave that example before. And then subcutaneous, pertaining to under the skin, right? OUS is pertaining to, and then sub is under, and cutaneous is skin. And then the last one here, transdermal, which means pertaining to through the skin. All right, same as percutaneous. Transdermal and percutaneous are the same. All right, so here's a couple images for you to take a peek at. One represents hypodermic and the other subcutaneous. Remember we said hypodermic is pertaining to under the skin, and subcutaneous also means pertaining to under the skin. Or, I'm sorry, subcutaneous means, pertaining to under the skin. Here's an image of onychomycosis, and if we are to fill in these word parts, remember osis means an abnormal condition, onycho means nail, and myc or myco means fungus, abnormal condition of nail fungus. All right, so some medical terms containing combining forms indicating color. Remember we talked about some color words when we first started this lecture. And so let's just look through some of these. The first one is acrocyanosis. All right, remember, osis, abnormal condition of. Acro is the extremities. Cyano refers to a blue color, right? So this is abnormal condition of blue of the extremities. Now here again, we have cyano, that means blue. So here we have an abnormal condition of blue. Remember we said erythro means red, so here we have the red blood cell. And then here we have a reddening of the skin, okay, erythroderma. Leukocyte, do you remember what I said that word means? If you said to yourself or thought to yourself, white blood cell or white cell, you would be absolutely correct. And the last one here on this slide, leukoderma, right? Remember, derma means skin, leuko means white. So white skin or skin that is white. Okay, a few more here. Melanoderma means black skin. Remember, melano means black. Derma means skin. That A is just something fun we throw on the end. Melanoma, again, we have the word part meaning black, and then we have the word part meaning a tumor, okay, a tumor. So this is a black tumor, and probably implies that we're referring to the skin there. Xanthoma, Xanthoma is a yellow tumor. Xanthoderma, remember xantho meaning yellow, derma meaning skin, yellow skin, or skin that is yellow. And then lastly, xanthosis, which remember, osis means abnormal condition of, and xantho means yellow. So abnormal condition of yellow. Now here's a few pictures of some erythrocytes and some leukocytes. Remember, erythrocytes are red cells and leukocytes are white cells. So the erythrocytes are on the left and some leukocytes are on the right. Here is an image of a melanoma, and remember we said that this is a black tumor, or tumor that is black, and you can see that it definitely looks very darkish black there on the skin. Okay, moving on to the next objective is to define, produce, and spell medical terms that are not built from word parts, and this is a little bit more difficult sometimes because we can't break the words down into their constituents. So let's take a look at some of these. The first one that we're going to look at is abscess, and an abscess is a localized collection of pus accompanied by swelling and inflammation. Remember, signs of inflammation are swelling, redness, heat, pain. The book notes that abscesses can occur in tissues and in organs and in contained spaces like the abdomen or the chest or the head. Basal cell carcinoma, abbreviated BCC, is a malignant tumor of the skin, the epithelium, and it arises from the bottom layer of the epidermis. And that it gets its name because that bottom layer of the epidermis, that outermost layer of the skin that we can touch and see and feel, is called the basal layer. Okay? Basal cell carcinoma rarely move or travel to other places in the body. Remember, we said that term is metastasis. Typically, these guys invade local tissues and often reoccur in the same location. Now, we already talked about a biopsy, and the biopsy is a removal of a sample of tissue, and it's abbreviated BX. We also have edema. Edema is a puffy swelling of the tissue, and this is typically due to accumulation of fluid. So something is not going right in the vascular / lymphatic system. Too much fluid is being dropped off into the tissues and not enough is being picked up by the lymphatic system. This could be due to severe hypertension or some sort of inflammatory process that's going on in the body. We also see something called cellulitis, which is related to edema, and cellulitis is inflammation of the skin and subcutaneous tissue that is typically accompanied by edema and characterized by redness, pain, heat, and swelling as well. A laceration is a cut on the skin. Typically, it could be in an organ as well, like a lacerated liver. And then we have the term lesion. And lesion is any visible change in tissue resulting from injury or disease. So here's an example on the nose of this gentleman, a basal cell carcinoma. Remember, what's the abbreviation for basal cell carcinoma? If you said BCC, you would be absolutely correct. Remember, these are typically malignant tumors that arise from that bottommost layer of the epithelium called the basal layer, and typically they do not metastasize. All right, some other terms that we should be aware of. The first one is pressure ulcer. Now, a pressure ulcer or pressure injury occurs and causes damage to the skin and the subcutaneous tissue. A lot of times we also call that a decubitus ulcer, and these pressure ulcers, a lot of times we see them on these little frail people that can't really ambulate well, and so they're spending a long time laying in bed, and that pressure on those bony prominences can lead to a breakdown in the skin and the underlying tissues. We call that a pressure ulcer or a decubitus ulcer, or the layman term is a bed sore. Now, squamous cell carcinoma is abbreviated SQCCA, and that is a malignant growth that develops from the scale-like epithelial tissue, right? It's called squamous. Squamous refers to the shape of the epidermis. They're kind of these very weird, irregular shaped cells that lock together very tightly, okay? These cells invade local tissue similar to the basal cell carcinoma. The difference is at these squamous cell carcinomas are known to metastasize. So they can, while they appear most commonly on the skin, they can also occur in other parts of the body as well, including areas like the mouth, the genitals, and the lips. Now, staphylococcus, remember we talked about that before. Coccus is the round, refers to the shape of the bacteria, which is round, and staph refers to how they arrange themselves, which I gave the example of a staph meeting, kind of forms a group of individuals, and these round bacteria arrange themselves in groups or clusters similar to grapes. Streptococcus, again, that round-shaped bacteria that arranges themselves in a strip or a chain. We call that streptococcus. So we abbreviate staphylococcus as staph. We abbreviate streptococcus as strep. Here is an image of a pressure ulcer. This is just on the kind of near the tailbone here. And this is a common area because there's not a lot of fluff there or a lot of adipose. And so those bony prominences are pushing on the subcutaneous tissue and between whatever the person is laying on. And then here we see a squamous cell carcinoma. All right, on the left of this image, we see a staphylococcus. Can you see how they are kind of grouping themselves in these little clusters? And then the streptococcus is a very clear strip or chain, and they're kind of round shaped. All right, so I'm going to ask you, what is the meaning of erythema? Erythema means redness. Jaundice, on the other hand, means a condition of the, well, it appears in the skin. It's characterized by a yellow tinge to the skin, mucous membranes, and the white part of the eye, which is called the sclera. So, and that's really one of the characteristic signs that we're drawn to, that's more obvious, I guess I'm trying to say, is when the whites of the eye become tinged with yellow, that clues us in to jaundice. Now, pallor is the term that we use for paleness. All right, let's look at some abbreviations. The first one we're going to look at is BCC. Do you remember what that means? That stands for basal cell carcinoma. What about biopsy? Or BX. BX stands for biopsy. Let's look at the next one. What about decube? What are we talking about there? Decubitus ulcer, right? Or pressure sore or bed sore. Remember what we said MRSA stands for. MRSA stands for methicillin, which is an antibiotic, resistant Staphylococcus aureus, which is a round group-shaped microorganism. It's a bacteria that lives on our skin normally, right? And we said it's an opportunistic bacteria. So, and we live in harmony unless there is a break in our skin, and then it can take the opportunity to invade the tissues and cause an infection. Now, RBC, that is a red blood cell or an erythrocyte. Remember, we said erythrocyte means red cell. SQCCA, remember, squamous cell carcinoma. Staph, standing for Staphylococcus, and strep, that is the abbreviation for streptococcus. And then the last one here, white blood cell or leukocyte. Okay, do you remember which one is that we call this one on the left? If you said staphylococcus, you would be correct, or the plural would be staphylococci. And then what about the one on the right, the twisted chains? If you said streptococcus, you would be absolutely right. Staph and strep. All right, what about this guy? What is the abbreviation for this type of ulcer created by prolonged pressure? Do you remember? If you said decube, you would be absolutely right. So let's do a quick review. Remember, RBC stands for erythrocyte or red blood cell. WBC is leukocyte or white blood cell. BBC is basal cell carcinoma. What about SQCCA? If you said squamous cell carcinoma, you would be correct. What about BX? That stands for biopsy. And lastly, MRSA is the abbreviation for methicillin-resistant Staphylococcus aureus. All right, so now we're going to look at some differences between plural endings and singular endings. All right, so just a reminder, English suffixes. In the English language, plurals are formed by simply adding an S or ES to the end of the word, right? We have grape or we have grapes, okay? We have cup or we have cups, okay? So that's how we do it in the English language. But, and so here are some examples that the book gives. Sorry, they're a little wonky as far as their orientation here. But again, singular hand, plural hands, singular dog, plural dogs, singular box, plural boxes, singular mole, plural moles. Okay, if only all English was that simple, right? All right, so what about in medical language? Well, in medical language, many terms have Latin or Greek suffixes, and we talked about the origination of medical terminology from Greek and Latin verbiage. And forming plurals for these terms is a little bit different, okay? So what is the plural of mole? Now, we're not talking about the little fuzzy animal that likes to live underground anymore. We're talking about a little blemish on the skin, right? A redundancy on the skin that we would call a mole, all right? So what's the plural of that? Well, I'm glad you asked. It is a nevi. And this is I have a funny story about this because I can remember working at the surgery center and we were pulling our cases for the next day. And so we printed out the schedule. It was one of the circulating nurses and myself. And on the schedule it said excision of nevus. And she and I looked at each other, and she had been a nurse for a really long time. I had probably been scrubbing for about, 11 or so years. And both of us looked at each other like, what is a nevus? And so we looked it up, and it's basically a mole or a birthmark, right? So when we are making nevus plural, mole to moles, we change the ending of US to an I. Remember, we had this similar example with coccus. Staphylococcus, 1, streptococcus, 1, staphylococci, several. Streptococci, several, or more than one, okay? So let's look at some of these Latin suffixes and how they magically change from singular to plural. So the first example is the suffix a. If we are going to change it to the plural form, we add an e, and it becomes a e. Okay? If the singular form ends in ax, that becomes aces, okay? Ex becomes ices, is becomes es, like metastases, right? Metastasis, 1, metastases, more than one. Ix also becomes ICES, same as EX. And then UM becomes A at the end. And US becomes I at the end. So let's look at some word examples. The first one is bursa to bursae. So bursa is this little fatty-like cushion that are often occurring in our really large joints, like our knee. And so bursa in the knee or bursae in the knee, one or more than one. Thorax, we're talking about the chest cavity, right? But if we're talking about more than one thorax, we would say thoraces. What about cortex? Okay, cortex, when we change it to the plural form, becomes cortices. Another example is pelvis. One pelvis, more than one pelvis would be pelvis. And another example, appendix, that IX on the end. Remember, we said it becomes an ES, so one appendix, which is a little worm-like thing that is located on the large intestine, and more than one appendix, we would call that the appendices. Interestingly, it's the same when we're writing some sort of paper, one appendix or multiple appendices. Bacterium, that's one little microorganism, right? More than one, we would say bacteria. And then the last example here on this slide, fungus would be one, multiple Fungus would be fungi, that US changing to an I. All right, let's look at a couple more. MA. If the ending is MA, then plural will be mata. If the singular ending is NX, it's going to change to NGES, phalanx. All right, it's a part of our finger bone. All right, more than one would be phalanges. ON is the singular ending, A is the plural ending. SIS changes to SES. So let's look at some words. Sarcoma, remember the ending is MA for the singular form. If it's more than one tumor of the flesh, we refer to that as sarcomata. Pharynx, all right, like I gave the phalanx is the bone of the finger that changes to phalanges. Here we have pharynx changing to pharynges. Okay, pharynx is we use that to refer to the throat, right? Predominantly. A ganglion is a little cyst that arises from the tendon sheath, and if we're talking about one of those little guys, we say ganglion, but if it's more than one, we call it ganglia. Metastasis, again, I gave this example before. Metastasis is singular, and then metastases would be plural. All right, moving on. Identifying some medical terms by clinical category. So here we have some terms and we're going to match them up by category. Is it a term that's a sign or symptom, or is it a disease disorder? Okay, so here we have edema. What do you guys think? If you said sign and symptom, you would be correct. What about onychosis? Onychosis, is that a sign or symptom, or is it a disease disorder? If you said disease disorder, you would be right. What about melanoma? Sign, symptom, disease disorder. That guy is disease disorder. Cyanosis, what do you think? Sign, symptom, or disease disorder? If you said sign, symptom, you would be absolutely right. And then the last one, pallor. Remember, that means paleness. All right, what do you think that is? If you said sign and symptom, you are correct. Remember, signs are typically things that we can see. All right, we can see that a patient looks pale. We can see that they have edema. We can see that they have a blue tinge to their skin. But sometimes symptoms can't be seen. I have a headache. I feel nauseous. All right, we can't really measure that. We can't really see it. I feel anxious. Okay, I feel nervous. Now, sometimes there might be some signs along with that as well, right? Maybe we're getting an increase in blood pressure reading, or there's some sort of heart palpitation we can hear or assess. All right, let's look at a few more. What about dermatology? Is that, we're deciding, is it a term as surgical, or is it a specialty / profession? So the first one is dermatology. That one is a specialty / profession, right? Somebody studies dermatology, they can be a dermatologist, right? Which is number 5 down at the bottom. What about biopsy? Is that surgical, or is that a specialty / profession? If you said surgical, you would be correct. What about dermatopathologist? Surgical or specialty / profession? If you told yourself specialty / profession, you would be right. Let's look at the next one. Onychotomy. Onychotomy. Surgical or specialty / profession? Yes, that is a surgical procedure, right? We're cutting into the nail or separating the nail. And then the last one, dermatologist, we said, was a specialty or profession. Okay, so we are going to step away from the integumentary system and we are going to talk about the respiratory system, or as for fun, I like to say respiratory. However, any way that you would like to pronounce it, we are going to learn some similar things about the respiratory system that we did about the integumentary system. And that is, we're going to build, translate, pronounce, and spell medical terms built from word parts, as well as those not built from word parts. And then we're going to also look at some abbreviations. Okay, like I said, here are the objectives. We're going to go ahead and skip past those. And let us look at the respiratory system. So in a nutshell, you can see it here in this image. Air enters the nose or the mouth. Okay, let me get my little pin out here so maybe I can draw something. All right, so we can follow these arrows, air coming in and out, and the mouth, air can go in and out as well. But it's going to travel down the pharynx. Now, there are three parts to the pharynx. There's the nasopharynx that is located right behind the nose, the oropharynx, which is located right behind the mouth, and then the laryngopharynx, which is located around the area of the larynx, which is also called the voice box right here, this guy. Okay, now air is going to travel into the nose or mouth, down the pharynx, and between the vocal cords of the larynx, which we said is the voice box. From there, it's going to go down this long cartilaginous tube called the trachea. Okay, so it's going to come down the trachea, and then it's going to, the trachea is going to make a little upside down Y, and that upside down Y is called a bifurcation, and there's a special term for where the trachea branches into left and right bronchi, and that is called the carina. Okay, so once the air travels down the trachea and either to the left or to the right, this is happening simultaneously, right? As we take a deep breath in, and from those bronchi, there's littler branches called bronchioles. And at the end of those bronchioles, those little tubes, there's something that I want to draw your attention to over here on the bottom left, and those are called alveoli. Now, one is called an alveolus, more than one is called an alveoli. And to me, this looks like a cluster of grapes. Now, this is where gas exchange happens, and it's the terminum, the end, right, of that gas exchange, okay? Or, basically, air comes in, it goes into the alveoli, and the alveoli, the lining of those is about one cell layer thick, and so oxygen can travel across that membrane and be easily picked up by the capillaries of our body and then whisked away to all of our different tissues and cells to get them oxygen. Now the reverse thing happens, right? Because the waste product, one of the waste products of our cells is called carbon dioxide, and that is a waste gas, and it gets transported through the vascular system and it gets dropped off on the venous side of the capillary back at the alveoli, and it gets exhaled out. All right, and this is that process of respiration. Okay, so What are some functions of the respiratory system? Well, first, like I mentioned, the respiratory system moves air in and out of the lungs. All right. It also provides for intake of oxygen and release of carbon dioxide. Thirdly, it provides airflow for speech, right? It helps our vocal cords work. Without air, our vocal cords would not work and we would not be able to make sound. And then lastly, it enables us to smell delicious pies cooking, bread, if something is maybe not safe for us to eat, but it enables our sense of smell. All right, so this little diagram just gives us a visual of inhalation and exhalation. So let me run through that really quickly. On the left side, starting at the top, with inhalation, we have air containing oxygen that enters our nose and mouth. Like I said, it goes into the throat, which is the pharynx, down through the larynx, which is the voice box, into that cartilaginous tube called the trachea, and that trachea branches into left and right bronchi at the carina. Okay, from there it's going to go into the bronchioles, which are the little branches, and literally if we were to strip the lung tissue away, we would see this grape-like structure. If you were to take a cluster of grapes and pick all the grapes off and you have that little skeleton, that's what these structures of bronchi and bronchioles look like. And then you put the grapes back on and those are the alveoli, right? And that's where gas exchange takes place. So once oxygen gets to the alveoli, again, it's going to be picked up by the circulatory system and distributed to the tissues, right, for use, because we can't live without oxygen. Our cells can't function without that. They need oxygen to do their work. And after they've done their work, they produce a waste product called carbon dioxide. So that carbon dioxide, again, is going to get excreted by the cell into the tissues. It's going to get picked up by the venous system, right? Because the venous system is going to bring everything back to the heart, and along the way, it stops at the lungs. Okay, so that carbon dioxide is, once it gets back to the lungs, is going to leave the alveoli and go out, right? And that's just the reverse process of inhalation. Is carbon dioxide leaving the alveoli, it flows into the bronchial tree, which is those bronchioles, bronchus, into the trachea, past the larynx, into the throat, and out through the nose or mouth to the outside world. So let's look at some terms now that we know what the respiratory system does for us. Some terms that are important for us to know as far as combining terms are broncho. Broncho means bronchus or bronchi, right? We've used those words. Bronchus is one, bronchi, more than one. Capno. Capno is the combining form or root word for carbon dioxide. Laryngo sounds a lot like larynx. That's pretty easy for me to remember. Muco is the combining form for mucus. Naso or rhino is the combining form for nose. And ox or oxy is the combining form for oxygen. Lastly, pharyngo, which sounds very similar to pharynx, right, is that combining form for pharynx. Let's look at a few more. Here on this slide, we have pneumo or pneumano, which can be used interchangeably, lung and air. We have pulmono, which can also be used as a combining form to mean lung. sinuso, which is sinus, spiro, which is breathing, thoraco, which is the chest cavity, and tracheo, which is the trachea, or the windpipe in layman's terms. So what about suffixes? Some suffixes that we will see with terms associated with the respiratory system include ARY or EAL. And again, that means pertaining to, pulmonary, okay? Pertaining to the lungs. Synthesis. Synthesis is surgical puncture to remove fluid. Pneumocentesis. All right? Ectomy is surgical removal or excision of. Now, don't get this one confused with tomy. Remember, cut into me, right? That's the incision into. But when we're talking about ectomy, we are taking something out. Okay, we're removing something, like pneumonectomy, right? That would be the removal of a lung. Another suffix, IA, refers to a disease state or condition of. Meter is an instrument used to measure. And PNEA, and usually the P is silent, is the combining, is the suffix for breathing. Some additional suffixes we have. Raja, which is the rapid flow of blood. Ria, which is flow or discharge. Scope, which is an instrument used for visual examination, like a thoracoscope would be an instrument used for visualizing the thorax. Scopic is pertaining to visual examination. Scopy is visual examination. Thoracoscopy, okay? Thoracoscopic. And then stomy is creating a new opening or an artificial opening. And then lastly, thorax, we've heard before, suffix meaning chest or chest cavity. Now let's look at some prefixes. All right, so let's talk about some prefixes. Some prefixes that we might use with terms relating to the respiratory system. The first one, a or an, which means absence of or without. Another one is dis, which means difficult, painful, or abnormal. Endo, meaning within, and hyper, meaning above or excess. And then there's an additional one that is not on here, and that is poly. And poly means many or much. So let's look at some words. The first one is apnea. So apnea pertains to without breathing, okay, or the absence of breathing. Bronchitis, on the other hand, is referring to inflammation of, remember, itis, inflammation of the bronchus. Bronchopneumonia is pertaining to the bronchus and the lung, right? That's a condition of. Dyspnea, that's difficulty breathing. Another term that we can kind of use the suffixes, prefixes, word parts that we have learned already is endotracheal. Endotracheal is pertaining to inside or within the trachea. What about hypercapnia? Hypercapnia, right? That means excessive breathing. The reverse of that would be what? Hypocapnia. What about hyperoxia? Hyperoxia is the condition of too much oxygen. Okay, the reverse of that would be hypoxia. And then lastly, we have hyperpnea, and hyperpnea is going to be like fast breathing, right? Or excessive breathing. And here we have some of those opposites that I had mentioned before, like hypocapnia. Remember, hypocapnia, a condition of deficient carbon dioxide, where hypopnea is deficient breathing. Hypoxia, right? We have a condition of deficient oxygen. Laryngitis, remember what itis means? Right, inflammation. So this is inflammation of the larynx. Laryngeal, again, pertaining to the larynx. What about the term mucoid? Remember what the ending OID is? It means resembling mucus. All right, and then we have our term mucus, which is a condition of, and then nasal, which is pertaining to the nose. So what other terms can we build? Well, we can build terms like nasopharyngitis, which is inflammation of the nose and pharynx. Pharyngeal, which is pertaining to the what? The pharynx. Pharyngitis, which is inflammation of the pharynx. Pneumonia, which is a condition of the lung or breathing. And then we have pneumothorax, right? The chest and the lung. All right, so here, pneumothorax, we have air inside the thoracic cavity, right? That is the characteristics of a pneumothorax. So pneumothorax meaning air in the chest cavity, and that is constricting the lung, okay? Our chest cavity is a closed system. And what that means is that it is not acted upon by the atmosphere that we live in. Now, we all know that there's something called gravity and atmospheric pressure. And if our lungs are exposed to the outside world of that atmospheric pressure, then the lungs cannot inflate. Okay, and that's what we call positive pressure. So if there is a breach in the thoracic cavity, air is going to rush in and it's going to push against the lung. Now, blood can do this as well. We call that a hemothorax. Either way, the blood or the air must be evacuated so that the patient can regain functioning of their lung. Okay? Other terms that we can discuss: endotracheal, right? Pertaining to within the trachea, which I think we've seen some of these words before actually. So mucus we saw, nasal, pharyngeal, pulmonary. Thoracic is pertaining to the thoracic cavity. Let's look at the next slide. Here we have a bunch of different scopes, scopies, and scopics. Remember, this has to do with either an instrument that's viewing a specific structure or cavity, the process of viewing it, right, or the actual procedure name. Okay, so we would schedule a patient for a bronchoscopy, right, which is viewing the bronchus or bronchi with a scope. That's the surgical procedure. The scope or the instrument that we would use to view that structure is called a bronchoscope, okay? And if we are needing to measure the amount of carbon dioxide that the patient is putting out, which one of these do you think we would use? If you picked capnometer, you would be absolutely right. This is the device that's used to measure the output of carbon dioxide. What about this very last one down here, laryngoscope? This is a device that is used to view what? If you said larynx, you would be absolutely correct. All right, so here we are seeing an image of a bronchoscopy. And during a bronchoscopy, a bronchoscope is inserted through the nostril, down through the pharynx and larynx and the trachea and into the bronchus. Here we're looking at an image of a laryngoscope. Now, a laryngoscope is used to insert an endotracheal tube, and an endotracheal tube is what we use when we put the patient to sleep and they're unable to breathe on their own under general anesthesia. So this is how we are going to get oxygen into their lungs. Laryngoscope. The nurse anesthetist inserts a endotracheal tube with a laryngoscope to guide the tube into place. All right, so we talked about laryngoscopy, right? That's the procedure that we're going to do to take a peek at the larynx. Oximeter, what do you think that measures? That is going to measure the oxygen, right? Remember, scope, scopic, and scopy each have the word root scope embedded into them. So scope creates nouns such as thoracoscope or laryngoscope or pharyngoscope. And scopy creates nouns such as thoracoscopy or laryngoscopy or pharyngoscopy. Now, scopic creates adjectives, okay? Remember, an adjective is a descriptor word. So examples of those would be thoracoscopic or laryngoscopic or endoscopic. And here is an image of a thoracoscopy. A small incision is made in between the ribs oftentimes, and then a scope is inserted in there to get a peek at the thoracic cavity. Here are some instruments that we use to measure carbon dioxide, oxygen, and breathing. So the capnometer, like I said before, is used to measure carbon dioxide, while the pulse oximeter is used to measure the level of oxygen. And a lot of times this goes on your finger. A spirometer is used to measure breathing, and that's usually something that has a little tube coming off from it, and you take a deep breath and you breathe into it, and it's going to measure the breathing. All right, some additional terms. Remember, ectomy means the removal of, whereas otomy means making an incision into. Cut into me, right, is the otomy. Ectomy, we're removing something. So with a laryngectomy, we're removing part or all of the larynx. What about a pneumonectomy? What are we removing there? If you said to yourself the lung, you would be absolutely correct. Now, do you remember what the ending synthesis means? If you said to a surgical puncture to withdraw fluid or something of the sort, you would be absolutely correct. Here is an image of a thoracentesis. Remember, a thoracentesis is used for both diagnostic and treatment. It's a surgical procedure that is used to remove fluid from the chest cavity. Now here we see a tracheostomy. Remember, ostomy is the creation of an artificial opening, and trache is the word part that refers to the trachea. So tracheostomy means creating an artificial opening into the trachea. And this is typically done if the patient cannot breathe or something is lodged in their airway, or if the patient is not breathing on their own and they haven't been breathing on their own for a long time, maybe they have an endotracheal tube in, and over time that doesn't benefit the patient. So they may perform a tracheostomy so that they can continue to breathe long term for the patient if the patient's going to be on a ventilator. All right, let's look at some terms that are not built from word parts. Okay, words like asthma is an example that is not built from a word part. Okay, asthma is a breathing condition, okay, where there is constriction of the bronchi, and there's difficult breathing there. Other terms like chronic obstructive pulmonary disease is a disease that leads to difficulty breathing. Emphysema is a disease as well. Influenza, we are familiar with that. We abbreviate that as the flu. Okay, and then we have something called obstructive sleep apnea, or OSA, and that is a condition where there's cessation of breathing during sleep for one reason or the other. And then lastly is URI, which stands for upper respiratory infection. Some other terms that are not built from word parts is our CT scan, which is chest computed tomography, which is a type of imaging. Chest radiograph can be abbreviated as CXR, or chest x-ray. Okay, and then last one on the list here is C and S, which stands for culture and sensitivity. And we will do culture and sensitivity tests, or we'll take samples for them to be tested in pathology or in the lab or wherever, whether it's a little sample of tissue or some sort of fluid. And the culture is the little sample that we take of the fluid or tissue or whatever, and the sensitivity is a test that is performed in the lab to determine what type of antibiotic or antifungal, or whatever the case may be, the microorganism is sensitive to, so that we can get a better idea of how we can treat whatever bug is invading our patient. And again, we talked about some of these: the chest computed tomography, which is the CT, that URI, which is upper respiratory infection. Tuberculosis is also a disease that affects the respiratory system, where there's these little tubercles that form in the lungs. That's also, the TB test that we get is testing for tuberculosis. Sputum is something that the lungs produce if there's like an active infection or something like that is going on. It's typically a mucus secretion. And then lastly here, the respiratory therapist is typically that individual who works to treat diseases or symptoms of the respiratory system. All right, here's an image of obstructive sleep apnea. And again, this is the absence of breathing during sleep. The pharyngeal muscle relaxes and it allows the airway to close, and that blocks off the breathing. All right, let's look at some abbreviations now. Okay, let's see how we write these abbreviations. So the first one is COPD, which is chronic obstructive pulmonary disease. Remember what C and S stands for? If you said culture and sensitivity, you would be absolutely right. CT is how we abbreviate computed tomography, and CXR is how we abbreviate chest x-ray. Now, flu is short for influenza, whereas OSA is short for obstructive sleep apnea. RT is our respiratory therapist. SOB, not what you're thinking, stands for shortness of breath. TB is our abbreviation for tuberculosis. And lastly, URI is our abbreviation for upper respiratory infection. So here is an image of a chest x-ray or chest radiograph, and you can see the equipment on the left side and the actual result on the right side. Sometimes they have mobile units that they take around the hospital or into the OR as well. This is a CT, which stands for computed tomography. And you can see here how the CT produces sectional radiographic images, and they can be taken in any of the anatomic planes to give a multi-dimensional view of the internal structures of the body, which is really awesome. All right, so are you familiar with another common way to abbreviate computed tomography scan? We didn't always abbreviate it as CT. You might have heard of it as something else. If you said CAT scan, then you would be right. Computerized axial tomography was how we used to refer to CT scans, and so you may hear them referred to as CAT scans. The respiratory system professional, again, this is showing the spirometer, and this is an important part of most hospital stays, and then a lot of times they send this device home with the patient, and this just encourages the patient to take slow, deep breaths because especially if we have conditions of the respiratory system, we want to encourage breathing. Breathing is a good thing. All right, that also helps us to avoid something called atelectasis, which is the collapse of a lung. All right. So a couple abbreviations here, RT, and then RCP, which is Respiratory Care Practitioner. All right, what is the abbreviation for this radiograph of the chest? Did you say CXR? If you did, awesome. That stands for chest radiograph or chest x-ray. So just a quick review of the abbreviations that we've talked about. Do you remember what TB stands for? TB stands for tuberculosis. What about SOB? SOB stands for shortness of breath. What about flu? Flu is short for influenza. What about COPD? That is the abbreviation for chronic obstructive pulmonary disease. And then lastly, OSA is our abbreviation for obstructive sleep apnea. All right, Let's see if you can name the abbreviation for these definitions. The first one is, this is a progressive lung disease restricting airflow, which makes breathing difficult. What is the abbreviation? The abbreviation is chronic obstructive pulmonary disease. Let's look at number 2, infectious bacterial disease, most commonly spread by inhalation of small particles and usually affecting the lungs. What do you guys think? If you said you think TB, you would be absolutely right. That is the definition for tuberculosis. All right. Moving on, we're just going to practice identifying medical terms by clinical category. All right, so what are clinical categories? Well, there are a few of them. There are signs and symptoms, which we looked at before, as well as diseases and disorders, diagnostic tests and equipment, surgical procedures, which we looked at before, specialties and professions, which we looked at before as well, and then related terms. So let's see how we do. All right, the first one is dyspnea. What do you think the clinical category is for dyspnea? If you said that's a sign or symptom, you would be absolutely correct. Remember, dyspnea is difficulty breathing. What about laryngitis? What clinical category does laryngitis fall into? That one falls into the category of diseases and disorders. What about pneumonia? Well, pneumonia is also categorized as a disease / disorder. What about hypocapnia? Hypocapnia is a sign / symptom. And lastly, tuberculosis. Is that a disease / disorder or sign / symptom? What do you think? If you said diseases and disorders, you would be absolutely correct. All right, you guys did it. You made it through lessons 3 and 4, which covered the integumentary system and the respiratory system. Great job.